Hi, Sacroiliac with New Hope Chiropractic. Pain in the lower back is very common in part due to the large number of things that cause it. In addition to lumbar disc degeneration, facet joint inflammation, and muscle tightness, one of the potential causes of a patient's pain is dysfunction of the sacroiliac joints. These are the joints that connect the sacrum, a structure at the base of your spine, to the pelvis. Although pain from sacroiliac joint dysfunction can be a major problem, it's often responsive to the non-invasive, non-addictive treatments provided in a chiropractic office. The sacrum is made up of several vertebrae that are fused together without any discs between them. Some of the roots of the sciatic nerves emerge from the sacrum and the coccyx or tailbone, which hangs beneath it. The top portions of the pelvis are the iliac crests, and the places on either side of the sacrum where it connects to the pelvis are normally among the body's more stable joints. The deep connective soft tissues in the pelvis and pelvic region in general keep the sacroiliac joints in place and provide them with some cushioning. When the sacroiliac joint becomes inflamed, we call this sacroiliitis. However, inflammation is not always necessary for the joint to be unstable or too stiff. Sacroiliac joint dysfunction doesn't always have a clear cause, but it can sometimes be traced back to traumatic injuries, different kinds of arthritis, or the weakening of joints and connective tissue caused by hormones released during pregnancy, for example. So people are also at risk of developing it if one of their legs is longer than the other, to create stress in the area. Pain from sacroiliac joint dysfunction can radiate to the lower back, the buttocks, the groin, even the thigh, but it's usually only felt on one side. It can be described as dull or sharp and sometimes mimics symptoms of sciatica. The pain is often worse when a person walks upstairs or has to stand for a long period of time. Several tests are used to diagnose this dysfunction of the sacroiliac joints. A lot of them involve a doctor pressing against the sacroiliac joint and other structures to see what causes a response, and some require a patient to demonstrate their range of motion too. The doctor can also try numbing the joint to determine whether that alleviates the pain. Imaging tests can be set up to rule out other potential causes too. Adjustments by hand or instrument are one of the most popular and effective ways of relieving pain in the sacroiliac joints. Also, in addition to adjusting the joint itself, a chiropractor may work the surrounding soft tissues. If they've tightened, rest can also be helpful for joint pain immediately after an injury, but allowing the soft tissue to go unused for too long will cause them to tighten. So it's a good idea to get professional advice about which movements are safe and to do those movements. Some chiropractic offices provide hard and soft tissue adjustments and mobilization while the patient lies on a specialized table with movable panels that'll help them to stretch. Other treatments besides chiropractic can be heat, ultrasound, therapeutic massage, deep tissue work. And preventing sacroiliac pain from returning can require a person to engage in physical therapy too occasionally and perform exercises that improve the hip, the strength there, and also the flexibility. When the SI joint is too loose, someone might also be given a pelvic brace to wear when they're not doing strength training exercises. So anyway, these are all non-invasive, non-addictive, safe ways to treat sacroiliac pain. And in our office, this is one of the things we specialize in, treating sacroiliac joint pain and also help with the low back and sciatica type issues. Check us out at newhopechiropractic.com. You can also book an appointment through our website, and we look forward to helping you in your journey to better health and wellness. And with that, have a very, very healthy day.